I'm Dr. Jen with White Wave Bodywork, and today I'd like to talk to you about diastasis recti. It's one of those terms that I feel like gets talked about a lot lately when you're talking about postpartum health. And I want people to know that a diastasis recti is not a death sentence. It is something that can be helped with exercise in an appropriate way. So when we're talking about diastasis recti, what we're talking about is the rectus abdominis muscle that attaches to the top of your rib cage and then to your pubic bone down here. It's that six-pack muscle or eight-pack muscle that runs up and down the front of your abdomen. It's the most superficial or forwardmost muscle in your abdomen. What happens when we get pregnant is these muscles that run down the front of our body get separated. So imagine this is my rectus abdominis. As my belly is growing, it separates. Now, not only people that have been pregnant have a diastasis recti. I'm just using that as an example. When our muscles are separated here like this, the back body is getting short and tight, and the front body is getting overstretched. Now we're kind of designed this way. This is definitely a way that we're designed because the muscles, the here that run up and down, are separated by an aponeurosis or a flat tendon that is able to stretch. But what happens is after we give birth, we don't necessarily train those muscles to come back together. So people will have that diastasis recti for years and years and years, sometimes for the rest of their life, if they're not trained appropriately in how to bring it back together. So what I want to do is have a way for you to check and see, do I have a diastasis recti? So the way we check that is to do kind of like a crunch, because any activity that brings these two attachment sites toward each other is going to activate that muscle, and when it's activated and it has that diastasis, it's going to pull apart like this, and your belly muscles are going to push through. So the way we check it is we lay on our back and tuck the chin and come upright. While you do that, if you see a pooching happening in the center here, that's your abdominal contents pushing through because you have this overstretched aponeurosis that's like blowing up a balloon. And when you blow up a balloon and it gets really thin, you can push things through really easily. So that's what's happening. If you have a peak that's coming to the top there, a little peak in the middle of your belly button, then you can see it coming through. So you definitely have a separation there. Now that separation can happen anywhere along that line. So what you're going to do is tuck your chin and lift. So you're lift enough that you're pulling the shoulders a little bit up off of the mat or the floor, and you're going to take your fingers and see if you can find those two muscles right in between there and see, is there a separation in those two muscles anywhere from my rib cage all the way down to my pubic bone? And if there is, the way we measure those things is by width and depth. So if I were checking you out as a physical therapist, if I were checking that for you, I would let you know how deep it is based on my finger and how wide it is based on how many fingers would fit in that hole. So you could have a different width and a different depth at different places along your belly button. So what we're just looking for is how far is it separated, meaning how many fingers can we fit in between, and how deep does it feel like it can go. If I can fit 3 fingers in there and it goes all the way up here, it's a pretty significant diastasis recti. So that's just a little information about how I would check it if you were in the office, so how you could do it at home on your own if you were concerned about having that diastasis. Now with the diastasis, there are lots of things that we can do in order to help those muscles come together. When we're helping the muscles come together, we'll do things like transverse abdominis activation and pulling the belly button in towards the spine. That's one of the most foundational exercises that I think is important for someone with diastasis recti. And just to make sure that you're not activating that pooch at any time during the day. So I want you just to create some awareness around what you might be doing when you see that pooch or feel that pooch coming forward, and how you might be able to do it without activating it. For an example, let's say you're lying down in bed. Now I said the thing that activates it is lifting to get up, lifting your head. That's how we're testing it. That's how we're activating it to see if it's there. Now anytime you lift your head to get up out of bed like that, you're activating that and stretching it apart and giving it a chance to push further apart. So if you were lying down in bed, in PT we call this log rolling, you're gonna try to roll over on your side and push yourself up so that your daily normal activity isn't activating that diastasis and just making it worse. So that's just one example of something that you might want to consider avoiding in order to not activate the diastasis recti. So that's a little about diastasis recti. I hope you learned something. Thanks for watching.